Welcome to MedChat Monday podcast. I'm Dr. Ross Kopelman, your host, where I cover topics on health, wellness, and the latest advancements in medicine. You're going to hear from interesting guests who will give us insight into better understanding how to live healthier lives. When we were younger, we were given what I call a quote-unquote crash course into the do's and don'ts of sexual activity. I remember this when I was in middle school. My gym teacher was teaching the course to fifth graders, and there were only boys in the room. He told us if our penises get hard, it's because we are going through puberty. Not that we might be getting aroused or excited when we were starting to get attracted to other people. This was our introduction to sex education, and quite frankly, it failed. The biggest emphasis I remember when we entered high school was placed on teaching young men and women to use condoms if they engage in sexual activity. These courses, though, only scratched the surface and never let us truly be informed as we entered into our adolescence. These are topics we are going to continue to explore together. But today, we are going to focus most of our energy on the vagina and complications that might arise from sex. Because there is a lot we still don't know, especially if you're a guy, but still even if you are a woman. Most women experience minor vaginal problems from time to time. These problems might be related to your menstrual cycle, an infection, the birth control you might be using, a medication, or changes to your body after pregnancy. For instance, it is not uncommon for women to get a yeast infection, and in fact, 3 out of 4 women will experience at least one yeast infection in their lives. But did you know that 1 out of 10 women, and the numbers are a little higher in the US, closer to 1 out of 5 women, experience some sort of pain when they have sex? I'm sure most men are unaware of this. And if you are a woman and experiencing pain, you might be shameful about it. And unfortunately, for a majority of the cases, it goes undiagnosed because of the embarrassment of seeking professional help and guidance. Today, we have the pleasure of welcoming Dr. Dietza Katz, who has her PhD in clinical sexology. She is the co-founder of the Women's Therapy Center located in New York that attracts women from around the country. It's a center that specializes in urogenealogic rehabilitation and the treatment of female sexual dysfunction. She's also the co-author for 2 books, Parting the Curtains and Private Pain, that focuses on empowering women coping with sexual dysfunctions to regain their confidence in the bedroom. So, Dr. Katz, welcome to the show.
Thank you, a pleasure.
So, I was really excited when we set this up. I know the connection we have is through your niece, and I'm really happy that I have the opportunity to talk with you. So thank you again for taking time out of your busy schedule.
My pleasure. Anything to spread the word and enlighten people out there about this very, very common problems that are still hidden and not spoken about.
So let's start off in a general way and talk about why do you think there's a taboo about talking about sex?
Well, in a short way, it has been historically so that women are supposed to perform sexually. It's their duty, it's their call. If we'll go to sexual history over the millennia, we will find out that it used to be a commodity. And it's expected that they will do it. And a woman who finds herself having difficulties is now perceived as problematic, not a full woman, not performing her duties. What's wrong with her? Not loving her husband, and at fault. And even to today, as we do have clientele from around the world who comes to us, we have people from some cultures and some backgrounds where it is precisely laid so on the table. She's supposed to do this. She doesn't do it. What is wrong with her? She is no good. If she cannot be fixed, I'm taking another wife.
But luckily, we live in a day and age where we have medical interventions and ways of helping women regain their sexuality, correct?
Typically we do. There has been in the last, I would say, about 6, 7, 8 years, especially in Western medicine, more and more enlightenment, research, papers written about the topic, about the fact that it's not just a part going into a part, but rather that it has to do with the whole woman as an entity. Let's not forget, if we talk about sexual intercourse, the penis enters the vagina. There is a whole different aspect to that. It is something that we tell that the woman, the vagina is a hostess. It's up to the vagina to invite, to endure, enjoy, and to say, okay, visit is over. And thus that type of a right for a woman has not been exercised, has not been accepted, has not been given permission to be. But in the last so many years, more and more is coming to the fore about that, and allowing women to reclaim their rights as equal partners, even though the acts are different.
Because historically they weren't. They were, as you mentioned, women historically were commoditized. Exactly. Men might have had multiple wives, or they had a mistress, right. And so there was no such thing as having your own sense of self as a woman.
Correct. You had to perform. Basically, you had to procreate. You had to satisfy the male's desires. Sadly, even to this day, even in our great America, we still encounter such a perception and such societies or people or groups who still practice that notion. And yes, women are still always fit. Women take it upon themselves, right? If something does not work in that department, women say, oh, it must be me. Maybe it's a partner. Maybe there is an issue in the relationship. Maybe there is something else. But women feel indebted and to be really, it is a little strong term here. Sexual servitude by the woman is still rampant.
But why is that? Why is it? Women should feel that they're equal partners now.
They should, but they haven't because of the historical perspective, because of the fact that it's still exercised, and because of few other little details, and that is, one, the vagina is invisible, the penis is visible. Anything that's invisible opens the door to all kinds of misinterpretation if something doesn't go right, and fears and worries. Second off, the genitals unisexually are connected to our fight-or-flight nervous system, meaning it is a psychosomatic.
Of course.
And so the state of mind of the receiver, being the woman, the state of mind of the receiver is extremely important, because if she is not in total agreement with what's going on, her genitals will act or react. Less so for a male, much less so for a male. Again, for historical perspective, for procreation safety, or else we would have been extinct by today. But for women, it's very prevalent.
So do you blame the educational system, like I mentioned in the intro, that maybe children are not taught at an early enough age, what the vagina is, what the penis is, how it functions?
That I loved your introduction. I mean, it was said, but I loved your introduction because it is so. There isn't yet a full grasp and a full embracing of the difference in sexual templates and sexual thinking and behavior, preferences, desire, wants, etc., between males and females. And women are still not given full access to sexual rights. They're still fighting over reproductive rights, let alone sexual rights. It's still not happening. And the media has been an awfully destructive force, because in the media everybody is gorgeous, and in the movies everybody has an orgasm as soon as things just begin to happen, and everybody is panting and heavy, breathing, and it's success, and the fit is perfect, and everybody likes what the other does to them, and it's perfection at its best. And then we have patients who are being dragged in here by their male partners or sent here by their male partners saying, he says I'm not like in the movies, and he says she's not like in the movies.
I can't believe that. That's hard to believe.
And it breaks our hearts. We have them here, and it breaks our hearts. Public perception, the media, is totally, gone against the tide of giving women sexual rights.
If I may ask, I understand in the United States there's a big emphasis in the media about sexuality and sex. Is it different in different cultures?
Yes, it is.
There's more respect for women?
No, not necessarily, no. I lump the United States into the Western world, basically. But no, in some cultures, in some religion, the woman is still a vehicle. She has a reason. She does not necessarily have the rights to her expressions, to her preferences, sexual preferences, desires. Not everyone, obviously there are exceptions, but it's still so, and we hear horror stories ongoingly.
So how do we shift the conversation so that the men feel more informed?
Mm-hmm. Well,
because is it the men that need to be more informed, or is it also the women?
Both. Women have to be liberated. They have to be educated, of course, about the basics to understand what the body is all about, because the vagina, as I said, is invisible. Many women don't even understand it. Many women don't even know the difference between the clitoris, the vagina, or for that matter, what the clitoris is, and not the role of the mind affecting it for a woman so much more than for a male. And then women have to understand.
So are you telling me women are more complicated than men?
I must say that because I treated male after prostate surgeries many, many years ago, and they were so much more simplistic. I must say that.
Okay.
There was also, and then going back to your question, and then males have to be also reformed. It's not just educated. It's historical reformation that they have to go through, which in some cultures will not happen for eons yet.
Well, that's one of the reasons why we're doing this podcast. It's to inform young people, because those are the primary listeners of this podcast, about how they should treat their sexual partners. Mm-hmm. It's about wellness, and it's about understanding your body. Mm-hmm. So, I mean, that's one of the things that you and I are doing right now. We're proactively trying to educate people that are listening.
Perfect. And let me throw in, unless you were going to that later, let me throw in something else that is mind-boggling to a lot of people out there, men and women, patient or not. There has to be, from a female point of view, a bit of a separation between vaginal function and sexual enjoyment. The two are not necessarily inclusive.
Please explain.
So there is a difference between vaginal function or vaginal ability and sexual enjoyment, arousal, and everything goes there. And a simple way that we explain that to our patients, males and females, is the following. The penis feels, meaning the penis owner as well, that if I, the penis, like going to the vagina and it makes me feel good, then the vagina must be equally good to have me. Remember, the vagina is the hostess. If I'm coming to visit, the hostess...
I would argue that most young men believe that.
Precisely. I see it without fail in my clinic, in my practice. Whereas it is not so at all for a woman. And it's not so and that is from an anthropological, historical point of view. It has nothing to do with that. The vagina is a passageway for different purposes, for hygienic purposes, for medical purposes, reproductive purposes, sexual purposes. Women can, if any vaginal action, a tampon, a gyno, would have been sexually arousing, as the penis would naively think, then life would have been entirely different than it is today, and childbirth would be a fantastic event. But it is not so. In order for the woman to combine vaginal ability or function with sexual enjoyment, she has to be in the right frame of mind. She has to allow her mind to shut down from the mundane and really focus on the physical enjoyment of the act or the getting into the act. She has to be in cahoots with a partner. Things have to fit.
Yeah, and I think men are very quick to move right to sex without realizing that there's complexities involved.
Precisely. There are complexities because of the anthropological nature. And again, if we could be a little philosophical over here, or I should say historical over here, the male should be willing, ready, and able to impregnate the female in nature, not only Homo sapiens, not only people. As soon as a female submits, although parentheses, there is rape in nature too. But the female tends to be more choosy. Who is the male who will give the best genes, the best reproduction choice and chance? So she chooses the male a little bit, and then she submits. So the male has to be willing, ready, and able. And also conversely, in your medical knowledge, that housing an egg and developing it into fruition, meaning an offspring, is extremely expensive. So
and complicated.
Complicated, exactly, until so many years ago. Women, the highest death rate for women were from childbirth until, was it 100 years ago or so? Got to be fact-checked exactly, but something like that. So that's what it is. So it is totally, totally different. So there is a total difference between vaginal function, sexual enjoyment and arousal for a female and the male. And for the female, sexual arousal, sexual enjoyment will never happen if vaginal function is not happening or is problematic.
So do you think because the vagina serves so many different functions that's the reason why women sometimes experience pain during sex?
Pain during sex could be a lot of podcasts on their own. But the short answer, there are many causes, many types of vaginal pains during intercourse. It could be psychosomatic. It could be...
Could you define psychosomatic for the listeners so they understand?
Sure. Psych meaning emotion. Soma is actually muscle in Latin. So psychosomatic is basically the body and the mind are expressing a distress call. Remember, genitals connected to our stress response system. So if a woman had a bad experience, and let's not think rape necessarily, although that's in the box too.
It could have just been a bad relationship with a girlfriend. A boyfriend.
Exactly. She could have had a yeast infection, and the guy came over, teenagers, says, but I really want to do it. And she relented because, she has to say yes, right? Women have to say yes regardless, right? So she did, and then it hurt more, and it chafed, and then it sent her on a slippery slope of a few months of discomfort. Well, that's going to send her vagina to have a major panic that may last for years. So pain during intercourse could be psychosomatic, meaning has to do with stress or negative experiences or memories or what have you. It has to do with dryness. It could be with intercourse that's lasting a lot longer than is comfortable for the hostess, yet the hostess doesn't say, finish or get out. Some sentence women are still shy to say, and men many times will not listen to. It could be because there are some other complications, maybe be medical, dermatological, behavioral, could be the angle, could be the male. The male penis could have some issues, and we always have to assess that to see compatibility too. So it is a very, very loaded area. In other words, it doesn't work like in the porno movies.
It's unfortunate that people equate the movies with reality because they're not one and the same.
That is, if the audience are listening to this carefully, the statement you just made is huge.
So the question, Dr. Cass, is how do we shift the conversation so that women feel more comfortable discussing the pain that they might be experiencing during sex with even their partner before they even approach a clinician for help?
Well, the good news is that in the last so many years, with internet and much more availability of resources in your palm, let's say Dr. Google could be good or bad, but the good side of Dr. Google does bring some information to the fore as long as a woman knows how to sort the right from the wrong, the bad from the good information. Yes, relationships have to have conversations. It's not, I'll come back to it. Relationship has to have conversations. Podcasts like you, educations like what you're doing over here, for the guys to develop respect, for the female to reclaim their rights. The media, I don't know if you and us are big enough to even make a dent in that awful dinosaur, in that awful moose that is so destructive. But
but if we can impact two people, two couples, or one couple, I think we're making a difference.
I'm with you, and that has been the motto of our practice for the nearly 30 years we're doing this type of work. Yes, it is just so. We have to keep enlightenment. We have to keep talking. We have to keep explaining. We have to keep encourage. And from the medical field, I have a bone to pick over here too. I still encounter to this day physicians, and I should say clinicians, not only physicians, could be the other, any medical professionals who deal with this thing, who are still doing any of the following. Oh, it's just in your head. Oh, what's the matter with you?
Are the OBGYNs saying this as well?
All the time. Oh, just take a drink, just smoke something, whatever. Or you don't love him enough. Or there is no solution. You got to live with it forever.
But do you see a difference between female physicians versus male physicians, or they're both acting the same?
Sadly, not yet. There are exceptions again. Everything I'm saying over here, there are.
Of course, we're making general statements. I understand there's always exceptions.
But those generals are frequent. So frequent. Unnecessary surgeries. I have so many cases that come to me on the verge of surgery, and they say, okay, maybe I'll come to you, give me an idea. And they say, I didn't even need the surgery. Why are they doing? They don't know what to offer, so medicine is trying to grasp at straws, whatever they can. The problem is that they are destroying women, and by not understanding the psychosomatic, we mentioned before, the psychosomatic connection to the genitals of the female especially.
And it's because you can't see them. It goes back to what you said. You can't really see the inner workings of the vagina.
Yeah, it is, as you said, one patient at a time. But every patient we help is a voice for others.
But as you said, it sounds like we have failed as clinicians to really create a safe environment for patients, women, to seek medical assistance if they have sexual difficulties or pain.
And respect the woman, not dismiss the woman, or not dismiss the woman because the clinician feels uncomfortable discussing this issue, or not dismiss the issue because her sexual preference is to be a lesbian, and therefore she doesn't need intercourse. So what does she have? She doesn't have any issue. No, they have needs too.
Very interesting.
Across the board, continuously.
So if I may ask, why did you open the Women's Therapy Center?
Oh, we fell into it by sheer mistake. Some 30 years ago, 29 years ago, Dr. Tabasel and myself, my business partner, we met in a medical setup, and we recognized the need to merge services because I was seeing them more from the medical side of it, and she knew about it more from the psych side of it, kind of thing. And then we realized that it's just not it. So we decided we'll merge services and we'll give it a shot, and the rest is history.
And are there still not enough resources for women out there?
I would say this is a correct statement, although I will refine it by saying there are many resources nowadays, good resources. There are many good resources, but as we all know, swimming through the enormous amount of information on internet search takes a skill that not everybody has nor the understanding to sort the rights from the wrongs.
So what are some of the major reasons why women come into your center?
Well, to be very precisely, we do a few things. Yes, we do also the sexual counseling and the arousal issues, libido issues and all that. Yes, we do. But because we work medical and psych combined, and we do, and it's like a psychosomatic gynecology, what we do here in the field of sexual medicine. The main diagnosis we treat over here, the one that we put on the map big time, is vaginismus. We basically took it out from being a sexual disorder to being actually a pain disorder, a psychosomatic disorder. So that's the biggest one. And then we have other associated conditions such as painful intercourse, which is called dyspareunia, the various the basket terms of vulvodynia and vestibulitis, which are complex set of...
most of the young women listening might think that if they have painful sex, they automatically have something called endometriosis. That's not necessarily the case.
And that is right. Also, that is a correct thing. But we don't see, right? It's very difficult to sort it out. Endometriosis could be an extremely scary concept for the woman. You have this tissue that's proliferating inside you. It's going to where it shouldn't be. You can't see it. You don't know what to do with it. It gives you pain. I mean, this is scary.
Of course. And they don't necessarily have someone to turn to. They can't turn to their male partners necessarily because the male partners don't experience these psychosomatic pains.
No. And with it, if I may sidestep a little bit to a prior content we had, see, one of the things we also tell women is when the male has an issue with a penis, say they have a case of an infection or they have a pimple or they have
a UTI,
or whatever they have, a prostatitis, whatever the male has, they're extremely protective of the penises. The same is in the sexual arena. Men has no issue telling you, I like it this way, not this way. Don't do here, don't do it. Touch here, don't do that. Push here, pull there. Men are very easy. Women are 180 degrees from that.
But I would even argue that's the case, like in the emergency room. I worked in the emergency room. I remember that there would be men who would come in with different medical issues that affected their genitals. But if a woman came in, the ER doctors didn't necessarily know what to do. If a woman came in with pelvic pain, they just automatically assumed it was one of the more common issues, and they just might not be informed enough about really, truly what's going on down there.
True. It takes a complex assessment to sort out what the problem is, because there is so much emotional input that comes into it, even if it is just a medical condition. But because the genitals are invisible, a vagina is invisible, because there is so much that's happening, because a woman accepts penetration into her, there are a lot more as you said, it's complicated, it's complex, and the emergency room is not the setup for any assessment like that.
So what does someone do if they do have pain? What's the first step?
If woman presents with pelvic pain,
they're having pelvic pain during sex.
Right.
Do they go to the internet? Do they look up the Women's Therapy Center and read the blog? Do they go to the emergency room? Do they visit their OBGYN? What should a young woman do first?
What do they do?
Or what should they do? What do they do and what should they do?
Okay. They do any of the above. First of all, it's awful. Then she feels something is wrong. Then she thinks something must be deadly wrong. Not necessarily cancers are not the big thing in this arena at all. Although it exists, but it's not the big thing. Usually just a functional issue. They do everything. They reach for the internet so many times. Oh, it's 3 o'clock in the morning. I just did the whole thing. We had intercourse. It hurt so much. I curled into a ball. I cried terribly. My partner tried to comfort me, or my partner fell asleep, or whatever.
Oh, well, I'm also assuming these women sometimes hide the pain. They don't want their partner to know that that they're having pain.
That's on top of it.
Or maybe they assume they're having their period.
And that too. You're just making a whole list of things. Yes.
Yeah, I mean, it's a black box. You really don't know.
That is true. And that goes together with the faking issue that is all together on the other side of it. But why even fake, So fake enjoyment, that is. So yes, it's a lot. So women will grab for the internet. Some of them will seek medical advice. And hopefully the medical advice will be enlightening and not dismissive. And then, each of those will go their own slippery slope from that. And the partner may be sympathetic, may not be sympathetic. And
is it ever the male's fault in terms of causing vaginal pain?
Yes, there could be. Yes, there could be some situation when it is the male fault. For example, and these are general comments.
Because I don't want to be quick to blame a woman's body for all the issues. And obviously we know there's psychosomatic, but I'm just curious, could a man be too rough during sex and that can cause potential issues? Yes. Are there complications with certain types of condoms that are used?
Right, correct. So yes, the male could also bring his causes to the mix over here. And mind you, it's not all psychosomatic with the female, but the psychosomatic is the umbrella. It's an umbrella hovering over everything and adding complications to it. A male could have different things, as you said. Could be a reaction to the spermicidal agent that is used on a condom. It could be rough sex beyond the woman's tolerance, and the woman doesn't say stop. It could be demanded rough activity. It could be a penis that's a little longer than that vagina can house, and the male insisting into pounding it in, even if the woman says, if she knows, hey, back off a tad, this is just a little too much. So that could be a two. Could be a male condition called Peyronie's, whereby the penis is a little it's structurally bent when erect, and therefore it's so difficult for something bent to get into a straight vagina. So there are difficulties there.
Look, I think there's a failure. I really I blame the biggest failure is, I think, the educational component. I think the middle schools and the high schools have a responsibility to educate young men and women about sexuality, and that will then correlate into people treating each other with more respect.
Mm-hmm. That's
and
true.
then women be more comfortable if they have pain to express it to their partners, to express it to their clinicians. And I think the media has really served as as our resource for how we learn about sexual education. And I think back to when I was in high school. I mean, yeah, the girls learned how to put a condom on a banana. I don't even know if the guys did that. And then we were just kind of shoved out there. We didn't talk about fellatio, even though every young person does fellatio. And we go to college, and the only information we have in terms of how we should behave when we have sex is really from watching either porn or hearing stories from your peers. So, quite frankly, the reason the media is the way it is because our educational system has failed.
You're very right. And on that, two notes on this one. One, I always giggle. I mean, not necessarily overtly. I always giggle when I have this virgin male sitting in the room, and here we sit in the room, in the treatment room. We go through the physicality of it there. We talk about sex and his penis and education, set him up for intercourse, whatever things go. And he says, well, I know. I watched YouTubes. I checked with Google. I saw porn. Wonderful. That's one thing. But the other thing is the few occasions that we were invited to give a lecture at med school about female sexual dysfunction, or grand rounds about that. The few programs that did avail themselves of the idea that what they really teach is about men only. it was really very well received because there isn't any of it in med school. It's all from the male perspective.
Yeah.
And then those clinicians go out there and they carry, you know how it is. What you taught you in medical school is the Bible. So you go on from there.
Well, there's a taboo against talking about it in the high schools, and I think also the parents are like, my parents never sat me down and talked about sex. They just said, "Be careful." That was the message, but they never said, there was never instructions on what is good behavior and what's bad behavior.
And there was not much openness at the time too, and parents don't know how much to do. The whole system is so bad.
So, Dr. Katz, what does it boil down to?
It's more about calling the part what it is, not all kinds of other letters and names and nicknames. And it's about women's rights and women's function and the emotional side of sexual connection for him and from her.
Dr. Katz, I want to thank you for the time that you spent. I think we covered a lot of great topics and that are going to inform the listeners. And I appreciate the time that you spent. I'm really happy we were able to do this.
I am delighted to be here. And as you said, if we were able to help one person out there, it was a good day.
The information expressed on this MedChat Monday podcast are the opinions of myself and my guest, and should not be construed to be a replacement for a consultation with your medical provider. Thank you for listening.